health, about 3,000 cases of colorectal cancer are detected in Ghana annually. About half the number of patients diagnosed with colorectal cancer in Ghana die due to inadequate specialized surgeons to effectively treat them. This was disclosed in an interview by Professor of Surgery at the University of Ghana Medical School, Jonathan Dakubo. As the world creates awareness about colorectal cancer this month, we bring you a special report on the disease and why early detection can help save life. There's more in the following report. Colorectal cancer is a type of cancer that affects the colon, large intestine, or rectum. According to the World Health Organization, WHO, the condition is the third most common cancer, contributing to nearly 1 million deaths in 2020 and over 1.9 million new cases globally. The disease is projected to reach around 3.2 million new cases per year by year 2040. Meet 45-year-old Kingsley, not his real name. He is a survivor of colorectal cancer. Kingsley was struck by the disease 2 years ago and recounts the struggles he faced in diagnosing and treating the condition.
I started having the symptoms about 2 years ago, and I visited a whole lot of facilities, both private and public facilities. And anytime I go and they diagnose me, what they tell me is, I have ulcer. I have ulcer. So I kept treating ulcer. And with the ulcer, I do both orthodox and traditional medicine. But I got to a point where I was not responding to treatment. So I was recommended to go to a certain hospital to meet a certain specialist. I went there, I met him, and he recommended I should do some labs and tests. Until finally, they told me this is my problem. And as at the time, they told me I had colon problem. My colon, the tumor had already covered more than 90%. The tumor was very big, or is very big. From what I saw after the surgery, you see this rubber paint, the small rubber paint, it has covered all the rubber paint.
Professor of Surgery at the University of Ghana Medical School and consultant surgeon at the Kolebu Teaching Hospital, Jonathan Dakubo revealed in an interview with Joy News that Ghana records between 1,500 to 3,000 cases of the disease every year. But half of those diagnosed die due to low awareness.
Globally, we are seeing about 1.8 million new cases every year, and about half of this number of people affected by the disease die. That's about 900,000 every year. Ghana is part of the global picture, and we suffer our own fair share of this cancer. It is estimated that we see anything between 1,500 to 3,000 new cases of colorectal cancers in the whole of Ghana. And about half of this number of patients also die. The awareness of colorectal cancer in Ghana is really very low. If you see blood in your stool, that could be a sinister symptom of a cancer. But because people are not aware of this disease, they refer to bleeding from their anus as being hemorrhoids, piles, or what we refer in our local parlance, cuckoo.
On the street of Accra, we ask random Ghanaians what they know about colorectal cancer.
I don't know anything about colorectal cancer. Even I haven't heard the name before. This is my first time.
Oh, I know nothing about it.
I did not do science, so sickness, I don't know much about sickness.
Apart from the low awareness, Professor Jonathan Dakubo reveals an acute shortage of specialist trained colorectal surgeons as a major challenge hampering effective treatment of the condition in Ghana.
The country has done very well when it comes to infrastructure to treat all cancers, including colorectal cancer. What is important is the surgical expertise to adequately treat the cancer. Because if the surgery for this cancer is not effective, whatever you do, the patient's life will be lost. So surgical expertise is very, very important. And that is the capacity that we are putting in efforts to develop.
Kingsley is, however, appealing to the government to enhance the capacity of specialist colorectal surgeons in order to reduce the high costs associated with treatment.
From the time I started experiencing the problem, let's say 2 years from now, up to medication, surgery, lab tests, and everything, diagnosis, I've spent over 100,000 Ghana cedis, which is about 1 billion old currency. What I will tell government, or I will appeal to government, is to help the colorectal specialist surgeons in Ghana to build their capacity.
Professor Jonathan Dakubo insists on early screening and diagnosis as a crucial step in preventing needless death.
Early screening is very important, and for all the screening programs that has been advocated in the health delivery system, it is in colon cancers that it has been shown clearly that screening can actually reduce the incidence of this disease.
The World Health Organization, WHO, has designated the month of March every year as Colorectal Awareness Month, and everyone is encouraged to screen for the condition. For Joy News, Carlos Caloni, Accra.